I'll quickly try to look at the next medical procedure before us, and this is what is known as chemoembolization. Chemoembolization. So chemo just simply means you are using chemicals, right? Embolization is kind of like I'm trying to block a blood vessel, right? So I can be doing this because probably I want to stop blood supply to a particular place. Of course, it's because of a particular medical reason, right? So chemoembolization is also known as what? Transarterial Chemoembolization, and it's a minimal invasive cancer treatment, and it delivers chemotherapy directly into the tumor's blood supply while blocking that supply at the same time. You understand? So in my explanation, I only got the aspect of blocking the supply, but what you are using to block the blood supply, right, is also a medicine. So it will indirectly also be acting on the tumor or the cancer growth, you know. So chemoembolization combines two actions. So chemotherapy drugs are injected directly into the artery feeding the tumor. You know, most of those tumors, they depend on a lot of blood supply for them to be able to be growing wildly like that, you know. So embolic agents are tiny particles that are used to block the artery. So this will now cut off the blood supply. Okay, I seen this. These are the small tiny particles. You understand? So this traps a high dose of chemotherapy inside the tumor while starving it of what? Oxygen and nutrients. So it's two ways. You understand? So how is it done? So you can see this one. The catheter was passed right here at the thigh, right into wherever. You understand? So you can use the femoral artery, you can use the radial artery. Okay. So, well, it depends on where the tumor is at, you know. So a catheter is inserted through the femoral artery most at times. That's the preferred site. So you are using all those real-time x-rays to now guide your movement so that you don't injure structures there. So a chemotherapy drug or an embolic material is now released into the tumor's artery. So the rest of the liver and the body are spared from high drug exposure because what? The medication is going directly to the site where you have the issue. So you can mainly use it for all those liver cancers, you know, used for metastatic cancers too. Okay, cancers that are likely to kind of like spread to other parts of the body. Alright, so benefits is there's high local drug concentration with fewer systemic side effects. You know, tumor shrinkage can improve symptoms. It preserves the liver function. Okay, so recent side effects is you're having a post-embolization syndromes, you know, liver damage or infection in some rare cases, blood clots or bleedings at the catheter site. Alright, so that's it.